Milton is the name of the gigantic hurricane that on the evening of Wednesday, October 9, around 8:30 p.m., hit the western coast of Florida near Siesta Key in Sarasota County, south of Tampa Bay, then continued its path of destruction inland from the state. In a short time, it went from a tropical storm born in the waters of the Gulf of Mexico to a Category 5 hurricane, the most disastrous, capable of reaching winds of over 156 miles per hour. Downgraded to Category 3, Hurricane Milton made landfall in Florida, packing winds of 120 to 125 miles per hour, waves over 13 feet, and flooding and storm surge that inundated densely populated areas, also spawning about 27 tornadoes. Heralded as the strongest storm in 100 years, Hurricane Milton, in the early hours of Thursday, caused widespread power outages for more than 3 million people, flattened dozens of homes and buildings, flooded roads, and an unknown number of injuries and deaths. Hurricanes are extreme weather events capable of devastating entire cities, wiping out everything in their path, taking countless lives, and redrawing the geography of entire territories. Drowning, electrocution, and trauma caused by debris carried by high-speed winds, falling trees, or the structural collapse of houses and buildings are among the leading causes of death during a hurricane. While these are the most obvious and tragic effects of the destructive force of nature, a series of collateral effects that impact the health of the affected communities should not be overlooked, often less visible but equally dangerous. Hurricane Milton brought storm surge to much of Florida's Gulf Coast, inundating densely populated areas such as Tampa, St. Petersburg, Sarasota, and Fort Myers. Flooding can release massive amounts of toxins and chemical and biological contaminants into aquifers and water supplies, which are highly dangerous to health. The large influx of water from torrential rains and flooding can damage underground pipes, reservoirs, wastewater treatment plants, and water distribution systems, contaminating entire public water systems. In floodwaters, we can find both chemical contaminants, such as pesticides, fertilizers, heavy metals, industrial solvents, and toxic waste, while among biological contaminants we find bacteria, viruses, and parasites. Among the microorganisms most frequently found in brackish waters after a hurricane, and in particular when fresh rainwater mixes with salty seawater, we find Vibrio Vulnificus. It is a flesh-eating bacterium belonging to the group of Vibrona, known to be the causative agent responsible for cholera. Vibrio vulnificus is able to penetrate open skin wounds exposed to contaminated seawater, and once it reaches the deeper layers of the skin, it causes necrosis of the affected tissue. If the infection is not treated in time, it can cause the death of the individual, especially in those subjects with a compromised immune system. Hygiene problems and overcrowded conditions in shelters after a hurricane create an environment conducive to the spread of viral bacterial infections, respiratory infections, and gastrointestinal diseases. Leptospirosis, for example, is one of the most common infectious diseases after a hurricane, especially in less developed countries or tropical areas. It is caused by bacteria of the genus Leptospirosis, which during floods contaminate the soil or water, which is then used for drinking or washing. If left untreated, it can cause kidney damage, liver failure, breathing difficulties, meningitis, and even death. Hurricane Milton hit Florida with wind gusts that reached 120 miles per hour. Its destructive force, in addition to having ripped off roofs, uprooted trees, and damaged infrastructure, contributes to a significant deterioration in air quality. The strong winds have raised large quantities of dust, debris, and toxic materials from destroyed buildings and industrial plants, which end up accumulating in the air. These are highly irritating substances for the respiratory tract, capable of causing asthma attacks, coughs, bronchitis, and breathing difficulties, as well as aggravating the symptoms of those who already suffer from chronic respiratory diseases, increasing the risk of complications and further damaging lung function. Children, adolescents, and workers involved in repairs on structures damaged by floods are among the categories most at risk of developing respiratory diseases. In fact, a study conducted after Hurricane Katrina in 2005, one of the 5 most serious hurricanes in U.S. history, showed a significant increase in upper and lower respiratory tract infections in the affected population. Extensive flooding from Hurricane Milton and water infiltration from roof damage creates ideal conditions for mold growth and proliferation, both inside and outside flooded homes. This puts occupants of these homes at excessive levels of exposure to mold spores, which can lead to respiratory symptoms and allergic reactions, especially in those who are more sensitive. Heavy rains and flooding significantly increase the humidity in the air and in homes, which can lead to skin irritation, respiratory problems, and joint pain, especially in those with rheumatic diseases. Extreme weather events, such as Hurricane Milton, are traumatic events with a strong psychological impact, which can cause survivors to suffer a range of mental health consequences, both short-term and long-term. First responders, emergency workers, and children are more likely to develop trauma-related symptoms after a hurricane, so timely psychological support is essential to reduce the emotional impact. Past hurricanes have shown increased rates of post-traumatic stress disorder, anxiety, stress, and depression in affected communities. Hurricane exposure and subsequent losses can lead to the onset of new mental health conditions in survivors or worsen symptoms in people who were already living with a mental illness. Affected individuals are also at increased risk of experiencing recurring nightmares and sleep disturbances, such as insomnia. In conclusion, hurricanes have been shown to cause and exacerbate multiple diseases, with most of the negative health effects peaking within 6 months of the catastrophic event and lasting for months or years. Hurricane Milton, whose death and injury toll is still unknown, remains one of the most powerful hurricanes in decades and comes just 2 weeks after Hurricane Helene, which had already brought the area to its knees, causing massive damage and the deaths of over 200 people in the southeastern United States.